Hello and welcome back. In this video lecture, we'll be talking about the difference between coding primary versus metastases or secondary and other important points with coding neoplasms. Okay, when we talk about different histological terms, if the morphology is stated, the coder must locate the morphology of the tumor in the index next to the diseases of in the index of diseases and injuries. So these are terms like lipoma, melanoma, sarcoma. They have specific codes, and you can get those right out of the alphabetic index. However, not every entry in the index is going to include the codes. Glioma, subpendymal brain has a cross reference and directs you to go back to the neoplasm table. See neoplasm uncertain behavior by site. So you may have to check both places. And if the morphology is stated, but the physician is not including a site, you should locate the morphology of the tumor in the index. And certain types of morphology indicate anatomic sites as the only possible site where the tumor would have developed. For instance, serous papillary carcinoma has an entry for an unspecified site and a code of C56.9. In this case, you have to just trust the alphabetic index. This type of cancer only occurs on the ovary. And again, if you're uncertain about the behavior of a neoplasm, for example, carcinoma, it's always going to be a primary. And the coder should reference the ICD-10-CM neoplasm table first, locate the site, and the code's going to be based on the behavior of the neoplasm. In other words, the behavior that we talked about, primary, secondary, what have you. There are a lot of instructional notes in this chapter that will direct you to include such things as alcohol abuse and dependence, alcohol dependence and remission, tobacco dependence, and history of tobacco use. And so these things are right in the tabular, which is another reason you always want to make sure that you validate your codes in the tabular so you don't miss those instructional notes. Other notes will direct you to use additional codes from Chapter 4 to identify any functional activity associated with any neoplasm. You can see a note under category D3A, benign neuroendocrine tumor, and C7A, malignant neuroendocrine tumor. And it tells you to code any associated multiple endocrine neoplasia, the MENS syndrome. And you use additional codes to identify any associated endocrine syndromes, such as carcinoid syndrome. And we talked about this earlier, but it bears mentioning again the classification of malignant neoplasms. And if it's primary, it's going to fall into C00 through C75 or C7A, C76, or C80. If it's secondary, in other words, the metastases would fall C7B, C77 through C79. And if it's a soft cell cancer, in other words, these lymphatic or hematopoietic cancers, C81 through C96, the leukemias, the lymphomas, these are systematic, so they don't metastasize. And again, there's specific instructions in the tabular, particularly with multiple endocrine neoplasia, the codes E31.20 through E31.23. So read all the instructions in the tabular very, very carefully. And then sometimes we don't have a primary site determined, believe it or not. All right. So if it's an unknown site, it's C80.1. We also have category C76. These are malignant neoplasms of other and ill-defined sites when a more specific site cannot be identified. Primary malignant neoplasms with contiguous sites. There's some specific guidelines for this, and sometimes you'll see neoplasms that overlap two or more sites. So these are coded to subcategory zero point 0.8 unless there's a combination code that's specifically mentioned elsewhere. An example of this is we can have a primary malignant lesion of the jejunum and ileum, which would be C17.8. When we use the term secondary sites, we're talking about metastases. And figure 5.2 in your text describes how metastases occur, so I won't describe it here. And metastatic cancer is the same name or cell type as the original or primary. So, for instance, metastatic breast cancer is the primary, and frequently it will spread to the lung, could spread to the liver, and so on. Sites of cancer metastases are most commonly the bone, liver, and lung, although they can occur other places. A new primary occurs when a patient develops a cancer a second time and it is unrelated to the first cancer site. A recurrence is when the original cancer recurs in the same organ. A patient may have a metastatic tumor, but the site sometimes cannot be found. And if this is the case, we use the specific codes and guidelines for that. And when sometimes students will ask, so how do you know if it's a metastases or a new primary? And again, this is one of the things that the pathologists look at. They put the cells under the microscope, they get that tissue, prep it, look at it, and there's certain properties where they'll be able to determine whether it's a new primary or a secondary in most cases. Table 5.2 in your text describes the primary sites and the main sites of metastases. Another term that we see besides metastases and metastatic to is direct extension to or extending to, right? And this is meaning that it's invading through the entire wall of an organ and it's going into surrounding tissue. So, for example, we have this. We have metastatic carcinoma of the colon to the lung, right? So it just says colon, that would be C18.9. And then we have the secondary malignant neoplasm of the lung. Let's take a look at that in the tabular. Okay, so we would find the colon cancer, but what I do want to show you is the secondary. So again, neoplasm by site to code that secondary lung cancer, we go to lung, and then here we go, C78, and then we would validate that in the tabular right here. And that's all I have for you. Our next video lecture will cover how we code soft cell cancer and other cancer coding situations. Thanks for joining us, and we'll see you online. Bye now.